It's getting very popular in global market. Now in 2020, the average cost of bioprinting is like $2 billion. But in 5 years, this will raise up to $6 billion, and it will get very popular and popular. And there are many investigations in Korea, in Japan, United States, Canada, and especially Europe. This will be the future in new time, and the market will raise rapidly. This is a widely asked question. For as I'm a plastic surgeon, I can explain why are these used in plastic surgery. Nowadays, there are chronic wounds, and burn victim patients. So we can use the bioprinters in chronic wounds in burn surgery. Also, this is widely used in also reconstruction of the face. Like if we reconstruct the nose, ear, it's easy to tool, and it's applicable technique which we can use in plastic surgery, because the bioprinting system can give the defined structure of the organs and tissues. For example, when we look at the ear, there are definitions of the ear. So if we want to print this, it's will give a price material after printing system. And also they will combine the cells with the scaffolds, and there will be a living tissue that we can apply for the patient. The bioprinting system is getting it's in progress. So now there were in the past there were only one nozzle that were using only scaffolds, but now there are with 6 or 5 nozzles that you can make hollow organs, like you can make the aortic patch, you can make the aortic valve. Also, you can print the ear, and also reconstruct the nose with the tissues that are made from the bioprinters. The bioprinters will also combine different layers of cells, that the tissues will have different levels of tissue. Also, they will add some proteins and some growth factors inside. For example, if you want to use this in the wound, they will have the cells, the cellular factors, which are growth factors we call the peptides, and also they will have the living tissue inside it. And also, it's commonly used in bone surgery, like in dentistry. So it will have the matrix inside, and also it will have the cells that are mimicking the organs. Commonly, I can say yes. Yeah, in my clinic, we use the system. I have the privilege to use the system, the Korean system, which prints tissues. But it will be in the market soon. In Turkey also, other surgeons will use. But now we have the ability to make for the wounds, and for also for the burn injuries. So I can say this question, yes, in chronic wounds and also in burn surgery, it's the privilege to be the first to use in Turkey. Actually, yes, in the technology of bioprinting, we can use the stem cells, which are used in bioprinters, so they can combine the scaffolds with stem cells, so we will have a living tissue. I can say yes to this question. Uh, for this question, I can say we use mesenchymal cells in bioprinting system. Mesenchymal cells that they are obtained from the fat tissue, also sometimes from other tissues. They contain the chondrocytes, the also the fat cells that are the precursor cells are the mesenchymal cells. So these are used in bioprinting systems. When we use the stem cells in bioprinting system, that means that these cells will regrow, and they will make a living tissue that you will understand much better if I can say you will have a living tissue which has the cells that have the capability of reproducing, and also have the mitotic activity also. It is getting very popular in wounds and burn treatments. You know, when patients have non-healing injuries, or they have a huge area that must be covered, and they need emergency surgery, and when we cannot get the donor tissue from the body. So it's used in chronic wounds with non-healing wounds, we can say. And also we can use in burn surgery that will give us the facility to regrow the tissues in a short time. For example, in the dressing technique, if you use the dressing, the tissue will heal in months. But using the bioprinting system, these patients will heal in 3 weeks, and they will be in the in their normal life in a short time. So it's the main purpose to use this is getting the healing process quicker and getting back to life as soon as possible. Bioprinters and 3D printers different from the materials which they use. In 3D printing, as you can see from this skull, we can make the tissues from polymers. Polymers means that they have the carbon tissue inside, so you can have a tissue which is not non-living. But the 3D printers using bioprinter system, they have the cells inside and they have the matrix inside. The matrix means that the skeleton of the tissue, so you will have the skeleton of the tissue and the cells, and you will combine them together and you will have a living tissue which is used in bioprinting system. So the main difference is one is alive, the other one is not alive. Actually, we can say it depends on the patient. This can be one time, or we can apply this 3 times. It depends on the patient. So if he has a non-healing wound, which is we encountered for years and years, this will take more sessions. But we can roughly say it's between 1 and 3 sessions, depending on the patient's situation. Bioprinters are the machines which are used in tissue engineering. So what we use in this technology, we use biomaterials and also bioinks. So they combine together to mimic organs. Finally, we can make organoids and mimicking organs tissues. It's getting very popular in the medicine and in surgery. In tissue engineering, there are various types of bioprinters commonly used. But as myself, I'm using the bioprinter called Dr. It's from Korea. It's using fat tissues to build scaffolds. These are used for burns and also chronic wounds. It's getting very popular in the Asian market, also in the Gulf market, and it will get popular in as soon as possible. Bioprinters are used in different purposes, but some patients have, chronic disease that we cannot surgically correct them. So we need tissues that can cover the defect area. So, for example, if the patient is very old or he or she has a chronic disease, we have to do the surgery and the printing system in a short time. So the advantage of the bioprinting system is to make tissues and scaffolds from the patients in a short time and apply to the patients under local or sedation anesthesia. Commonly asked questions about this. Yeah, in the future, the bioprinters will be in the field of organ making, but in our technology, as now, we can make organoids or scaffolds. Scaffolds means that you can make a partial tissue of the human. For example, if you want to make a scaffold for the dermis layer, or if you want to make a simple tissue for the bladder or for the heart. It's also in the common field of cardiology that you can make some valves and also aortic patches and also vessels. This will get more popular in advanced times, so we can make organs in the future. But now it's not very popular to make a whole organ like a liver or a kidney, but it's commonly used in chronic wounds, in diabetic foods, and in some defects of the body. And especially it's getting very popular in the field of burn surgery. Organoids and organs are different. We can say that organoids are small tissues that mimicking organs. The organs are very big portion of the tissue, but organoids are mimicking little tissues. Like they have their own structure. They can apply layers of tissues, but they're not like a heart or they're not like a liver, but they mimic the liver. So you can make some research on organoids. In the future, the organoids will combine and they will make the organs. So we can say the organoids are the little portion of the organs.